Good morning, everyone. Good morning. Let's try this again. Good morning, everyone. Good morning. There we go. Excited to be here in Harrisburg and have everyone with us. Welcome to the PA Chamber's inaugural Healthcare Summit. It's exciting for us. I'm Luke Bernstein, President and CEO of the Pennsylvania Chamber. For those not familiar with the Pennsylvania Chamber, we are the largest broad-based business advocacy organization in the Commonwealth with approximately 10,000 members of all businesses, not just healthcare members, but businesses of all sizes in every industry, every sector, and every corner of the Commonwealth. And we are really excited to host this today because healthcare is so critical to our economy. And I recently was on a healthcare panel and we talked about I can't find a strong community in Pennsylvania that does not have a strong healthcare system. I can't find a strong healthcare system thriving and everything without a strong and thriving population. So they truly go hand in hand. And we have a great agenda for everyone today. We've got everyone from the Secretary of the Department of Human Services, Dr. Val Arkoosh, with us this morning. We have former Pittsburgh Penguins All-Star and Olympian Kevin Stevens with us today, and we have a really all-star packed agenda with great speakers, great topics. And as we were putting this together, looking at a number of different areas, from the medical liability and legal landscape to the role that AI plays in improving access and innovation, to strategies that are ushering in the next generation of healthcare workers. That's a huge piece we hear from all of our employers is talent, and certainly in this field as well. We'll talk about best practices to behavioral health that I know many of you have challenged with, not only from the healthcare side of providing, but also within your own employee base and for other employers that are here thinking through that issue. But this conference was crafted with your business in mind for you and your employees in mind, and how we can come to areas of common sense and consensus to move forward. The experts that we'll hear from today will help you gain knowledge and tools that you need to save costs, enhance your benefit offerings, and support your employees. So, before we get underway, I want to call your attention that there are postcards at your table. And you'll notice that at the postcards, if you scan the QR code, you'll see the breakout sessions that are on there. Attend whichever breakout session is important to you and that most interests you. And the postcards also have our upcoming events. We have our annual golf outing at the Hershey Country Club on Monday, August 19th. This event always sells out very quickly, so if you have interest, let us know sooner rather than later. That event will sell out. And another event that will sell out is October 7th, our annual PA Chamber Dinner. This is a milestone year for us, celebrating our 40th dinner, and it's going to be another unforgettable program coming up. So those two will be sellouts as they always are. So let us know quickly if you'd like to participate. You'll also notice a QR code on the one pager at your seats, and that's a digital link to an event survey that will help us more effectively offer you high-quality educational programming moving forward. So as you take a few moments throughout the day and fill that out, answering the survey, we'll be able to better provide programming that's important to you and your business. But let's start with those that without them we could not do this, and that's our sponsors. Today's exclusive platinum sponsor is Highmark, a diversified health and wellness system that works passionately to deliver high-quality, accessible, understandable, and affordable experiences, outcomes, and solutions to its approximately 7 million members across Pennsylvania, Delaware, West Virginia, and much of New York State. Let's give Highmark a warm round of applause. Our gold sponsor is MetLife, one of the largest global providers of insurance, annuities, and employee benefit programs with around 90 million customers in over 60 countries. Our breakfast and lunch sponsor is Geisinger, a regional healthcare provider to Central, South Central, and Northeastern Pennsylvania that serves more than 3 million patients, so roughly a quarter of the state, in 45 counties. Today's silver sponsor is PA Chamber Insurance, PCI. for the for-profit subsidiary of the Pennsylvania Chamber, which helps ensure businesses of all sizes across Pennsylvania can offer quality, affordable benefits to their employees. Our bronze sponsor are WellSpan Health and Emerge Education. Our break sponsor is Capital Blue Cross. Rounding out our generous list of sponsors is our Wi-Fi sponsor, Saxon Stump. Let's give all of our sponsors a very nice round of applause. With that, I would like to invite Joe Haddock, Segment President for Eastern Pennsylvania, with our exclusive Platinum sponsor, Highmark, to the podium for the introduction of our morning's keynote speaker. Joe.
Thanks, Luke. And good morning. All right, you warmed them up, Luke. Highmark is proud to be the Platinum sponsor for the inaugural Healthcare Summit. As Pennsylvania's only statewide Blues plan, we are also very proud to work closely and collaboratively with healthcare professionals and healthcare systems, as well as government officials, to ensure high-quality, affordable healthcare options, to support local communities through our charitable giving programs, and to serve our valued members through innovative care management solutions across all 67 counties of the Commonwealth. Now it's my pleasure to introduce this morning's keynote speaker, Dr. Val Arkoosh. Dr. Arkoosh was appointed to lead Pennsylvania's Department of Human Services by Governor Josh Shapiro on January 17, 2023. Prior to that role, Secretary Arkoosh served on the Montgomery County Board of Commissioners for 8 years and was the commission chair from November 2016 through January 2023. As a physician and public health professional, Secretary Arkoosh was at the center of Montgomery County's efforts to combat the COVID-19 pandemic, leading a data and science-driven approach through this unprecedented challenge. Her leadership was praised during the county's response, especially in regards to transparency and public communication throughout the pandemic. Before she stepped into public service, Secretary Arkoosh was professor of clinical anesthesiology and clinical obstetrics and gynecology at the Perelman School of Medicine at the University of Pennsylvania. Prior to that, she led the National Physicians Alliance, which joined the National Movement for Healthcare Reform. And because of this, Secretary Arkoosh has comprehensive knowledge on the implementation of the Patient Protection and Affordable Care Act, as well as its impact on individuals and the entire healthcare system. Secretary Arkoosh is a graduate of the University of Nebraska College of Medicine and received a Master of Public Health from the Johns Hopkins Bloomberg School of Public Health. She performed her residency at Jefferson Medical College in anesthesiology with a specific focus in obstetrics. Please join in welcoming to the stage Pennsylvania Department of Human Resources Secretary Val Arkoosh.
Well, good morning, everybody. Aha, the third time's the charm. I win the good morning. It's so great to be here with all of you today. Joe, thank you so much for that very, very kind introduction. Luke, I don't know where Luke went, but there he is. Thank you, Luke, so much for this invitation to be here with all of you. I didn't realize this was the inaugural Healthcare Summit, so I'm even more honored than I had already felt to be here with you today. And I'm not a former Olympian, so I'm sorry, that's not me. But I do bring a lot of other interesting experiences and background and look forward to sharing some thoughts with you this morning, a little bit about what I do at DHS, some of our ideas and visions and goals, and a little bit about how my very unusual background got me to this place. And then I think hopefully we'll have time for a few questions. So look forward to that. So, having practiced medicine and served as a county commissioner and now as Department of Human Services secretary and as a mom to 3 kids, I've had the opportunity to learn a lot about leadership over the years, what it means to be successful, what each of us can do to equip people we serve and our communities with the resources and skills that they need to be successful. But perhaps more importantly, we must not miss our chance to focus on how we make success sustainable. I wouldn't be here today without all the things that I learned and experienced through my medical and public health educations and the time that I spent teaching others. These are lessons that have driven my professional trajectory and continue to expand and evolve my work. I've been honored to bring what I've learned so far to DHS, and I hope that this perspective is something that can strengthen our work to help Pennsylvanians live the kind of enriching and healthy lives that we all deserve. One of the things that I've learned is the importance and power of sharing stories. And so I'd like to share a story with you this morning that really guides my work every single day. And this is a story about three friends who were walking in the woods. They're approaching a river, and as they get closer to the river, they hear a lot of screaming, and they realize there's a whole bunch of children in this river being swept downstream toward a waterfall. So one of the three friends jumps into the water and swims out and grabs one kid and brings them back to the shore, goes out, does it again. The second friend took a couple minutes and tied a few logs together and kind of made a little bitty raft and went out and got 3 or 4 children at a time. And thankfully, over the next period of time, the number of children in the river started to reduce, and then finally it stopped. So the 2 friends were greatly relieved, and at that point they looked up and they realized that their third friend was nowhere to be found, and they were pretty annoyed because they'd been in this water working pretty hard. And then, shortly after that, their third friend comes walking down the river, and they say, "Where have you been?" And the third friend said, "Well, I walked upstream to see why these kids were in the river in the first place, and to see if I could stop it." So when we think of problem solving, we're often taught to jump into that metaphorical river, or maybe to build that raft. We got to address that most urgent need. And certainly that's what I was taught to do as a physician in medical school. And these skills are extremely important. But sometimes before we can get ahead, we have to stabilize that crisis or solve that problem right in front of us. But it's really important and often very necessary to also think about, are there opportunities to make that problem a little easier to manage, or maybe to prevent that challenge in the first place? You may realize that the urgent need requires a short-term solution, a solution that is essential, but it doesn't get at the core reason for the problem in the first place, or do anything to really prevent it from happening again. We must meet people where they are and address their most urgent needs. It's a big part of what we do here at the Department of Human Services, but our work can't stop there. We've got to look upstream. DHS serves more than 3 million people directly through programs like Medicaid, SNAP, Child Care Works, and others that we administer or oversee. This represents more than a quarter of our Commonwealth's 13 million residents. And through other services, we touch the lives of millions more. It's actually hard to find a Pennsylvanian who isn't touched in some way by our work in their lifetime. DHS is a vast agency spanning healthcare, income maintenance, long-term care, child welfare, juvenile justice, disability services, behavioral health, licensing, and so much more. So this gives us countless opportunities to make a positive impact, and we must consider how needs and challenges look different along a person's lifespan. DHS's work is a direct investment in quality of life and opportunity for every Pennsylvanian. As you all know, many communities have been effectively treading water or heading toward that dangerous waterfall downstream, facing growing challenges to stability and to opportunity to live healthy lives with dignity. Strong communities across Pennsylvania form the foundation of a resilient and, very importantly, economically thriving Commonwealth. I thought what Luke said about the importance of health systems and thriving communities, they are truly linked. And as we see one go down, often so does the other. So this is a very important part of some of the things that we're looking at DHS. Investments by DHS in services and supports allow more people to have the opportunity to live that vibrant future. Our work begins with enabling stability But I firmly believe that that is not where, and it cannot be where, it ends. We must build bridges to success, to bolster, or in some cases build, foundational supports that have been weak or missing. While our work and involvement look different depending upon individual programs and services, it's not enough to view our work as something that is here only to stabilize in a difficult circumstance. The programs that we administer provide access to basic needs like healthcare, food, and shelter. These programs are a vital first step and an essential investment in the individual dignity and well-being of the people we serve. But we're also committed to using the resources and tools at our disposal to build those bridges to success, so each person that we serve has the opportunity to chart the course of their life in a way that defines success for them. I strongly believe that we must actively and intentionally use our reach and service to help prevent and correct disparities, inequities, and structural barriers that place and keep people in poverty and poor health. This is something that we absolutely cannot do alone, and these efforts are essential to ensuring a healthy and thriving workforce. To be truly successful in these goals, we must listen to and learn from the people living and working in the communities that we serve. We can and regularly do look at data from DHS programs to identify trends and themes. For example, our more rural counties often have a higher percentage of their population covered by Medicaid compared to other parts of the Commonwealth. Erie, Luzerne, Cameron, Fayette, and Dauphin have at least 30% of their county residents covered by Medicaid. The 8-mile stretch from the start of Broad Street in the West Oak Lane section of Philadelphia through City Hall contains about 11% of our entire state's Medicaid population. This section has about twice the national average of people living below the poverty line, and the life expectancy of children living in this area is about 20 years shorter, 20 years, than children in nearby wealthier zip codes. And when I say nearby, I mean 20 minutes away. And rural counties in Pennsylvania have a higher concentration of families with young children living in poverty. There are 13 counties in Pennsylvania where at least 20% of families with children under 5 live in poverty, and all of them are considered rural counties. In Cameron County, the county with the highest percentage, 39.5% of families with children under 5 live in poverty. These are unacceptable numbers that are indicative of the many ways that our systems and society have failed individuals and families living in communities around Pennsylvania. These statistics must be a call to action for all of us. Living in or near poverty can create instability in an individual's life, often causing them to compromise on essential needs to meet, one essential need to meet another. But poverty is not an individual problem alone. There are community and state level public health, workforce, educational, and economic impacts when people cannot afford to live and meet their essential needs. If we're going to help people toward success and have a chance to make truly impactful interventions, not only do we need to pay attention to this data, we must listen to community members and partners, advocates, and care and service providers, people like you, who know firsthand where and what those needs are, what has and has not worked, and what opportunities exist to strengthen how we help individuals and a community build a foundation for stability and for success. To approach this work in any other way would be short-sighted. The Department of Human Services regularly engages with advisory councils for our programs that include people receiving benefits and services, healthcare providers, payers in managed care, advocates, and others to understand how our programs are working and how we can strengthen our programs and services. And advocacy and listening to our partners and people with lived experience played a big role in making some of the initiatives that we are currently pursuing as part of the current budget cycle possible. Investments that, when taken at face value, may seem targeted in who they will help, but I assure you, these investments will have a broader impact on the economic health of Pennsylvania. Governor Shapiro's budget seeks to make a historic investment in programs that serve Pennsylvanians with intellectual disabilities and autism. If you are unfamiliar with this system of care, Medicaid covers home and community-based services that help people with intellectual disabilities live safely and independently. These services assist with tasks of daily living, therapeutic supports, and provide opportunities for engagement and participation in their community through volunteering, learning, and work. Historically, these services have never been funded in a way that allows everyone who qualifies to receive the right services at the right time. We and most other states actually maintain a waiting list for these services. Providers and advocates have fought for years, many, many years, and it's time that we move away from this practice. Our system of care and the dedicated professionals who serve Pennsylvanians with disabilities are and should be a bridge to successful everyday lives that all people deserve. The governor feels strongly about this, and his proposed budget starts a multi-year growth strategy to expand access to home and community-based services and effectively end the emergency waiting list for adults by increasing capacity within our waiver programs and investing in rates for service providers. Yeah, you can applaud that one. It's a big deal. We cannot approve access to services without also supporting the people who provide that care and support. Direct support professionals are at the heart of this work, and without them, there is no one to provide care, causing people with disabilities to go without support and either limiting job prospects or keeping parents and other families out of the workforce entirely because they need to be home caring for their loved one. I can stand here and explain to you the impact of these numbers and explain how transformative these investments will be if the General Assembly passes the budget. But who's really at the heart of this work are the advocates, are the families that have been coming to Harrisburg for years, who have met with me, who are meeting with the governor to talk about why these investments are so critical. Parents and siblings and caretakers and direct support professionals who aid and assist people with disabilities every single day. You know, when I was a county commissioner, I would occasionally get these phone calls, and they stick with me because they were so painful. Usually it would be from an older parent, often married, and their spouse had just had a medical emergency, a stroke, a heart attack that came out of the blue. And now one spouse is left caring for their spouse who's ill and caring for their adult child with an intellectual disability in their home. They called begging for help, and I unfortunately was not able to help them because of the way our current system is constructed. These individuals and their families are the reason we're able to pursue these investments. They have told their stories. They have advocated on behalf of themselves and their loved ones for years. And now we are on the cusp of making an investment that is going to radically change how this system operates and enable them to, and their whole families to live with the dignities that they deserve. Think about if you were charged with providing full-time, in-house care to an aging parent or loved one with a disability. Would you be able to do that and keep your full-time job without compromising the attention you pay to one or the other? As a mom of 3, I can say with certainty that my husband and I would not be where we are in our careers without childcare, something I think that any parent would be able to attest to. So this year's budget also seeks to increase reimbursement rates paid to child care providers who participate in Child Care Works, our subsidized child care program. This program eases affordability for lower-income working parents by subsidizing the cost of childcare, helping them to navigate the access barrier that could otherwise prevent them from going to work and building a career and providing for their families. Providers who participate are paid a base rate per child from the state. This rate is set at a portion of what the private pay market rates are. 5 years ago, our base rate was about 1/4 of the private pay market rate. which of course was unacceptably low. Today, Pennsylvania reimburses at 65% of private pay, and if Governor Shapiro's budget passes, we will increase this to 75% of private pay. This would bring Pennsylvania to the federal government's expected benchmark for rates and help close that gap between private pay and subsidized care, providing operational supports to providers serving lower income working families. This commitment to child care works providers to invest in quality of care and their workforce amid the continued challenges of operating in the current economic climate. When we target support towards rates paid for subsidized care, we invest in equity and opportunity for all children served by our child care workforce. We cannot sustain a vibrant economy without also strengthening this caring infrastructure. I am hopeful that this continued investment will provide more support to this essential field and the child care workforce that does so much for our children and so much for many of us. A report published by the United States Senate Committee on Small Business and Entrepreneurship cites data that an estimated 90% of child care businesses are owned by women, with more than half being owned by women of color. Child care is largely a small and locally owned and operated industry. When we invest in the people and small businesses who do this important work, we're investing directly in our communities and reducing barriers to work for parents of young children. As you think about your own workforce, I urge you to remember the impact that our obligations at home can have on a person trying to enter the workforce. It's an unfortunate reality for some families, especially families on more limited means, that the cost of working may be bigger than their paycheck. We have to make childcare affordable and accessible for people. So it's not a choice between pursuing a job and then the cost of actually being able to maintain that employment, right? It should be a clear choice that getting the job is the right economic choice for that family. So beyond these two initiatives, I'd like to share with you an exciting and transformative project that DHS is hoping to undertake in the 2025-2026 state fiscal year. We are in the process of pursuing additional interventions through our Medicaid program to further our ability to support vulnerable Pennsylvanians through various points in their life. Research has found that the social determinants of health account for 50% of geographic variations in health outcomes. And let me say that again. Those social determinants of health account for 50% of geographic variations in health outcomes, compared to, always makes me sad to say this, clinical care by people like me when I practice medicine, which accounts for 20%. And obviously that 20% is really, really important, particularly if somebody's acutely ill. But it's important that we look at the big picture. These health-related social needs, like stable housing, consistent access to nutritious food, social supports, a safe community, having clean water to drink, clean air to breathe, and more, can shape a person's health across their lifespan. It shapes their children's health and well-being, and both generations' success in education and the workforce. Looking beyond just the urgent need to the broader causes and stressors that influence people's health gives us the opportunity to get ahead of health concerns or make more sustainable interventions upstream. We must not miss clear opportunities to identify challenges and potential solutions. The Center for Medicare and Medicaid Services, for the first time, is allowing states to tailor their Medicaid programs to help meet these health-related social needs. The process that we go through to hopefully be able to do this is called an 1115 waiver. We hope to take advantage of this opportunity and work with the General Assembly and all of you to improve the lives of our fellow Pennsylvanians and reverse trends that are detrimental to their health, well-being, and overall quality of life. Our proposal spans 4 areas: housing, nutrition and food as medicine, reentry supports, and a multi-year continuous coverage for children through age 6. So let me tell you a little bit about each of these very briefly. Being safely housed can reduce hospitalizations. emergency department visits, and incarceration rates. A study on the impact of housing supports on Medicaid spending in Oregon found that housing supports reduced an individual's Medicaid spending by 12 to 16%. To realize a similar impact in Pennsylvania, my team has designed time-limited, short-term interventions to expand housing and tenancy supports like short-term rental assistance and social and emotional support to help people stay housed and reduce evictions. Data from the pandemic found that nearly 1 in 4 Medicaid households was food insecure, and women and people of color were more likely to experience food insecurity. Nutritional deficiencies and food insecurity can have a lasting impact on a person's health and ability to succeed in school and the workforce, leading to broader societal costs and chronic health risks. We may be able to slow or even prevent these issues by making healthy, nutrient-rich foods more accessible to people who don't have an affordable grocery store with fresh fruits and vegetables readily accessible. DHS is seeking to expand coverage for medically tailored meals, grocery deliveries, and other nutritional supports for pregnant and postpartum people experiencing food insecurity, newly diagnosed diabetics, and others with health conditions where the proper food is essential to managing the disease and helping people live well enough to live active, full, vibrant lives and be able to be part of our workforce. Food-driven nutrition programs have been shown to reduce overall Medicaid costs by 16%. These are interventions that can help entire families and give children and youth a foundation for healthy growth and habits throughout their lives. We also are seeking to better support the health needs of individuals who are returning to their communities after a period of incarceration. Reentry programs can reduce recidivism, reduce preventable health care use, and keep people much more stable as they return to their communities. In Pennsylvania, nearly two-thirds of individuals recidivate and cost the Commonwealth $3.1 billion per year in total societal costs. Programs in other states focused on housing alone, just housing, have led to sharp reductions in violations, as much as 82% in some studies. Rates of overdose death following reentry are extraordinarily high. On average, a 12-fold increased risk of death, and even higher in a recent analysis from Philadelphia County, where they saw that there was a risk of death 37 times higher in the first 2 weeks compared to a non-incarcerated population. Another recent national study of rural counties in the United States found that among people using drugs, 42% had recently been incarcerated and had much higher overdose death rates. These are problems we can fix. We know that transitions from prisons and jails is a very high-risk time and that individuals face significant barriers to reentry. Overdose deaths are more likely when individuals face gaps in care. This reentry program would create a stable bridge of coverage and care from prisons and jails to community treatment programs and help to reduce recidivism. And lastly, we want to encourage regular use of preventive and well-child visits and avoid disruptions in care by providing multi-year continuous health coverage for Medicaid-eligible children through age 6. As you all know, early screening, interventions, and preventive care to address physical, behavioral, and developmental health needs leads to better outcomes through adolescence and into adulthood. This investment in uninterrupted access to care for children will have a lifelong impact. So we recently submitted our 1115 waiver application, which we've titled Bridges to Success, Keystones of Health, to the Centers for Medicare and Medicaid Services. The full application is available on our website at dhs.pa.gov if you want to check it out. And there's all kinds of details there about what we're hoping to accomplish. If approved by CMS, we will then work with the General Assembly to move this program forward to help Pennsylvanians achieve stability and success. And as I mentioned earlier in this talk, sustainability in this stability is really our goal, right? Sustainable stability. We can't just treat the issue of the moment and expect to change a person's history and life trajectory. But when we look at the core source of instability, we can help better equip people with the tools to care for themselves and take a step forward. Help them to be healthy and empowered and ready to steer their lives. Help them to find success for themselves and their family. Investments in healthcare and well-being and people themselves gives us that foundation necessary for them to pursue educational and professional goals. This is how we build those bridges to success, rather than keeping someone churning through that same cycle of poor health and ineffective short-term interventions. As I mentioned at the beginning, I just wanted to tell you a teeny tiny bit about some of my journey to being here with you this morning. Certainly never imagined when I started medical school that I would be the secretary of a Department of Human Services. And stay with me on this because all these dots will eventually connect. I can say with certainty that I wouldn't be where I am today if it were not for my time practicing medicine. And really what that comes down to is the things I was able to treat as a doctor, but just as importantly, the things I was not able to treat. As a physician practicing in Philadelphia teaching hospitals, I saw the health of my patients impacted by issues that extended way beyond the exam room. I regularly bore witness to the impact of generational poverty, perpetuated by economic disenfranchisement, poverty wages, and exacerbated by societal challenges like systemic racism and biases and gun violence. To be healthy, so many of my patients needed stable housing and safe neighborhoods, that clean air to breathe and water to drink, or simply a grocery store in their neighborhood that sold fresh fruits and fresh vegetables. And as a doctor, I could not prescribe any of those things. These experiences began a shift in my perspective on my work. I could help treat that immediate issue right in front of me, but if what brought a patient to that office was being caused by or added to by these external factors, I quickly learned I couldn't cure the disease. These structural factors are not going to go away overnight, but they did motivate me to start thinking and asking, how can we do better? How can I be part of bringing the solutions that my patients and our community so desperately needed and deserved? And as I said earlier, so much of medicine is doing what we absolutely must in the moment to help a person stabilize, meet their most urgent needs, and start to chart a path forward. But while necessary, it really is just the first step. I realized that I wasn't content working only on the urgent issues, and I became very personally invested in how I could be part of looking upstream. I fundamentally believe that the opportunity to live a vibrant, healthy, and enriching, productive life is something that should not be a privilege based on the zip code that you were born in or your social identity. I wanted to broaden my focus and be part of the essential work to reduce and eliminate the systemic barriers to good health for my patients and for so many others. This desire for change took me back to school to learn about public health policy. As you heard, I got my master's degree in public health. And one of the most important things that I came to understand was the role that advocacy plays in developing public policy. While earning my master's degree, I was inspired to find and to use my voice, and this led me to join the National Physicians Alliance. It was a multi-specialty physician organization that worked with the Obama administration on what eventually became the Affordable Care Act. It was so important to me because at the time and where I practice, on any given day, 20%, some days 25% of my patients didn't have health insurance. You know, I think it's easy to forget what it was like before the Affordable Care Act. So while there's still so much more to do around making sure that everybody has high quality, affordable health care, I still know that advocacy at every step along the way has had a huge impact. So this is why Keystones of Health, our 1115 waiver, and our work at DHS to build those bridges to success for people is so important to me. It's an opportunity to make the impact and help people achieve stability that I couldn't practicing medicine. And it's that stability that is so foundational to helping people shift their life's trajectory and be able to live a full, vibrant life. It's how they feel confident and prepared enough to pursue their goals and to achieve success. And no one entity can do this alone. But working together, if we all embrace this upstream thinking, we can each of us in this room, play a role in addressing problems and opportunities from the source. DHS is working to make this collaboration easier for organizations across our healthcare systems, our community-based systems, and our social service organizations and government. Earlier this year, DHS and the health information organizations that comprise the Pennsylvania Patient and Provider Network launched PA Navigate, a resource and referral platform that can create that synergy between healthcare providers and community-based organizations to better help people who oftentimes we are all working to help in some capacity. Physicians, social workers, and other caregivers in clinical, nonprofit, and public settings may try to refer people for additional help and supports. PA Navigate is the bridge that's going to connect all that together to make it easy to refer somebody for food assistance or help with housing. And it's going to allow those partners that work with us in the community to truly coordinate that person-centered care that we each aspire to deliver. Like Keystones of Health, PA Navigate is about strengthening our infrastructure across systems who are often serving the same people and have an opportunity to work more effectively together than when we work in our individual silos. And it also gives us that opportunity to look upstream and get people the supports and address those long-term needs. That's how we build a healthcare system that's effective for all people and helps those in difficult situations navigate their circumstances and achieve a better life. This is all possible, but we do have to shift our view a little bit and think a little bit differently about how we do our work. We need to look upstream. And that focus of looking upstream has guided my move from medicine and public health to public service and now to leadership in state government. But I never forget where I came from and the many challenges that are faced by many of you in this room on the front lines of patient care. So please know that I'm here to work with you. That is one of my top priorities. It's not to be here to talk at you, but to be here to talk with you and to work with you and to be accessible and to hear your concerns. It is only by working collaboratively that we are actually going to change the trajectory for our fellow Pennsylvanians. So thank you again for the opportunity to share a few thoughts with you this morning, and really excited about your entire conference, and I hope that this becomes an annual event, and really appreciate the incredibly hard work that your teams do every single day across our Commonwealth, and I look forward to continuing our conversation. Thank you.